Okay, thanks very much. So we just move on now. We've got our next two speakers. So we have Dr. Diane Seddon, who's a reader in social care, and a PhD student, Maria Caulfield, who are both at Bangor University, and they're both going to talk to us today about some of the work on short breaks for carers. Thanks, Diane, and over to you.
Okay, the script, yeah, that's fine, thank you. So thank you, Jill. So I'm delighted to have the opportunity to share some findings from the short breaks work that I'm currently involved in. So during this short presentation, I'm going to share some findings from a recent scoping review that mapped the evidence base supporting short breaks for carers for older people. I'd also like to talk about a recent event, Learning from Lockdown, that explored the provision of short breaks during the COVID pandemic. And then my colleague Maria will share some findings from her research on short breaks provision for spousal carers who are looking after a partner with dementia. But before we go any further, I think it's important to take a moment to reflect on the terminology. So the terms used to describe breaks provision are quite varied. They include respite, short break, restorative, replacement or relief care. And the most common two are short breaks and respite care. And whilst these two terms are often used interchangeably, increasingly distinctions are being made. The respite is associated with traditional services, usually involving someone being supported in settings outside of their home. And there's an implicit assumption that respite indicates a pause from something that's unpleasant or difficult, even though we know that there can be positive aspects to caring. Now, while traditional forms of respite can be beneficial for families, and indeed they do have their place, it's suggested that the concept of a short break is becoming increasingly more acceptable to carers. So the term short break is associated with a shift in focus from supporting carers in their caring role to improving quality of life for both the carer and the person they support, and potentially including a break from routine together. So the term short break can be associated with the advent of more personalised, bespoke approaches to achieving those things that matter most to people, and with provision that also reflects the unique nature and qualities of caring relationships. And recently there have been calls for a fundamental shift in the way that people are supported to take a break, and the importance of personalised breaks has really been amplified during the COVID pandemic. The new Carers Plan for Wales, which was published yesterday, recognises the importance of such breaks and the need to work towards a new national model of breaks provision. So I'm really excited to be able to work collaboratively with the Carers Trust and Welsh Government to inform the development of this new model of breaks provision for Wales. But if we just spend some time thinking about the scoping review first of all. So the scoping review was undertaken to understand what research tells us about the impact of short breaks for carers and to inform a future research and practice development agenda. So we located research evidencing the contribution of short breaks to achieving a number of carer-generated outcomes related to health and well-being, a life alongside caring, positive relationships with the supported person, choices in caring, including decisions about limits to the caring role and satisfactions in caring. And to achieve this, we searched national and international literature that was published from 2000 onwards. And what did we find? Well, research highlights the importance of breaks for carers, and it captures the positive difference that they can make to carers' physical health, their emotional health, and also to their sense of resilience. And various breaks are described in the literature, including daycare, respite care, in-home respite, host family support arrangements, supported holidays, and also access to leisure and outdoor activities, which have become especially important during COVID. However, most studies evaluating the impact of breaks for carers focus on traditional respite care and daycare services rather than the bespoke, personalised services that have developed in recent years. So despite the plethora of research activity, our understanding of what makes these breaks meaningful and how access to personalised breaks might help to support positive, sustainable caring relationships is quite limited. So there is some evidence that breaks can support carers to achieve positive wellbeing outcomes. So, for example, an evaluation of the Creative Breaks programme in Scotland reports on improvements in carers' emotional health, and research reports improvements in carers' physical health following a supported holiday taken together with a spouse who's living with dementia. And similarly, Dementia Adventure report on the benefits of supporting people living with dementia and their carers to get outdoors, take positive risks, and to try new things. And clearly this takes on new significance given the current pandemic. However, the evidence base is too limited to draw firm conclusions about the contribution of these short breaks to realising positive wellbeing outcomes, and if they are realised, whether these outcomes can be sustained over time. So there are key evidence gaps, which include the features of a personalised break that support the realisation of positive wellbeing outcomes, the timing of these breaks as a preventive health measure, as well as comparative work looking at the short, medium and longer term outcomes from different break types. For example, residential respite, where a break typically involves separation, compared with, say, a supported holiday taken together. In 2018, a review of the international evidence base on support for carers suggested that combinations of interventions can be more helpful, but little is known how personalised breaks can combine with other interventions to achieve wellbeing outcomes, including, for example, combining personalised breaks with training or with relaxation or sleep management techniques. There is some evidence to suggest that personalised break options may support improvements in dementia caring relationships, but there's very limited research exploring how personalised breaks can impact on carer choices and decision making, including how they may shape carer willingness and ability to continue caring. So researchers here in CADR are actively trying to address some of these evidence gaps. So clearly COVID-19 has necessitated a rapid transformation of the ways we support carers and individuals with complex care needs to take a break, and draws into sharp focus, I think, the importance of personalised break options. And in January, the UK Short Breaks Research and Practice Development Group convened an online event, Learning from Lockdown. And the aim of this event was to share knowledge and experience about the impact of COVID-19 on short breaks, to highlight examples of creative approaches to breaks that have developed during the pandemic, and to capture what matters going forward to reflect the needs and preferences of those using short breaks provision. So, as we've heard from other speakers, the pandemic has created an unprecedented set of challenges for carers and people living with complex needs, as well as those who are involved in supporting them. And it was evident from our event that short breaks providers have responded flexibly and very creatively to try to deliver meaningful breaks. A core message from all of those taking part in the event was the importance of co-producing break options with carers to reflect what matters to them in these particularly challenging times. And a co-productive approach has enabled organisations such as CREDU to develop bespoke, help families to arrange bespoke short breaks in mid-Wales during lockdown. For example, their Creative Respite project has enabled families to think creatively about what would help them to take a meaningful break. And sometimes this is something really small or for a short time. So being able to take time for a walk, time to read a book, the ability to catch up with family and friends virtually. So unsurprisingly, supporting carers to maintain connections with others, either virtually or outside in safe spaces, was highlighted. And this included connections with other carers who can afford peer support, albeit on a socially distanced in a socially distanced way. And a number of innovative projects were described that enabled people living with dementia and their carers to spend more time outdoors with others, reliving old memories, creating new memories. So, for example, the Outside the Box project in Scotland, this included opportunities such as reliving sporting memories, engaging with wildlife and nature. And examples included Everton Wood, which is Scotland's first dementia-friendly woodland, where people living with dementia and their carers can engage with the natural environment in a safe and a socially distanced way. Now, clearly there are significant benefits to being outdoors, and these have been magnified by the pandemic. But for some, reconfiguring short breaks provision to include outdoor settings has really challenged their understanding and their attitudes towards risk and also towards risk management. So throughout the pandemic, technology has played an important role in all our lives, including for carers, and the importance of ensuring that technology is accessible and fit for purpose was highlighted by carers. The flexibility and commitment of staff to move online was also evident, and the challenges that this presented were also captured by staff with varying levels of IT knowledge and also access to IT at home. And as Patri alluded to earlier, the value and reach of technology-based support was identified as an important area for future research and practice development, as was support for staff to help people virtually. Delegates also emphasised that for carers who often report feelings of isolation and loneliness, technology was not a substitute for face-to-face contact. So during the event, the importance of self-care was also highlighted, including a personal account from one carer who shared her experience of supporting her mother with dementia during the pandemic. And this carer, who herself had MS, found that worsening symptoms, which she assumed were part of her condition, were actually alleviated through a break from caring. And she emphasised that simple things can really make a difference. So she talked about online complementary therapy sessions, and other carers likewise talked about kindness bags delivered to their front door and the provision of garden furniture and exercise equipment. We had a carer from Mid Wales who described how a new bicycle had really helped her to maintain physical fitness and emotional well-being during the pandemic. So clearly the opening of building-based services and facilities where short breaks may be taken does raise a series of challenges, not least allaying carer concerns about safety, risk of virus transmission to the person they support, and indeed risk to themselves. So going forward, embedding both creativity and safety into group activities will be particularly important. We know that the easing of lockdown restrictions across the UK regions is likely to raise concerns, and some carers may need support to re-engage with short break opportunities available in their local communities, including visits to cinemas, parks, other public spaces, etc. Going forward, I think there are really exciting opportunities to co-create and deliver short breaks that are underpinned by a robust research evidence base. And it's clear from our ongoing work that a future research and practice development agenda may be usefully clustered around 3 priority areas. So firstly, understanding what matters to carers and those they support is key. We need to understand more about the defining features of impactful short breaks, including in light of the pandemic. And this work may sit within a wider programme of research and practice development around assessment and support planning as co-produced conversations to explore what might work to support individuals in achieving positive outcomes. Then clearly, capturing health and other wellbeing outcomes resulting from a personalised break is important, as carers often identify a concern to maintain their own health and well-being in order to continue caring. So when capturing outcomes and the factors shaping these, we need to consider the different break types and how they influence well-being, including breaks taken together, breaks taken away from home, breaks offering carers opportunities for peer support. And I guess in the light of COVID, capturing breaks delivered via online resources or outdoors take on new significance. Clearly, personalised breaks rely on quality commissioning, so key to future research, connecting academia, policy and practice, are studies addressing the way to effectively commission and deliver personalised breaks at scale. So this includes exploring the range of providers, including social enterprise services, arts facilities, hospitality, tourism, as well as looking at the different means that offer flexibility and choice, including social prescribing, social enterprises, community-based groups, direct payments and self-directed support. So these are key to addressing the challenges of delivering personalised breaks post-pandemic to a diverse population in the context of rising demand and declining budgets. And for those who are interested, we have a paper that's currently in press that's exploring these issues. But for now, I'm going to hand over to my colleague Maria, who's going to present some of the findings from her ongoing research. So over to you, Maria.
Great, thank you very much, Diane. It's working. Brilliant. Okay, so I'm going to present a brief overview of some findings which helped capture some of the complexities involved in the provision of short breaks for carers who provide support for their partner living with dementia. And this research is funded by the Wales School for Social Care Research on behalf of the Welsh Government. So we know that the provision of short breaks is a complex and evolving area of support that requires a multi-sectorial effort. And particularly in these times of diminishing funds and resources, there is considerable challenge around delivering and sustaining short breaks that can meet the needs of the carer, but also the person living with dementia. And as highlighted in Diane's presentation, commissioning for short breaks that support meaningful outcomes is not only contingent on understanding what matters to those who care, but also having a knowledge of the landscape in which commissioners and providers work. So reflecting this research opportunity, we conducted interviews with 26 staff. Some were employed by local authorities and some by third sector carer organisations. And we discussed their work in planning, commissioning and delivering short breaks. And this research was conducted in a region in Wales, and the data collection did finish before the introduction of any COVID-related measures or restrictions. And based on our interview work, we developed a model of the short break landscape, which really brings together some key factors that staff felt were crucial in supporting meaningful provision and outcomes. So I'll explain the different components of the model and how they work together now. So at the centre of the model is the relationship between the carer and their partner living with dementia. And we refer to this process, we refer to the relationship as being a core process. The nature of caregiving is often reciprocal. And so understanding the interdependencies that may exist between the couple and their values and preferences is really important in delivering meaningful support. Several contexts relevant to the provision of short breaks were also identified. Firstly, the cultural context, which is made up of the perceptions, the morals and beliefs of carers. And these influence how carers interact with services, their sense of duty to care, and the degree to which they identify as a carer, which we know is often an important first step in accessing statutory support, such as a carer's needs assessment. Secondly,
sorry, Maria, can I just interrupt just a couple of minutes? Okay.
Oh, okay, great. I'll whiz through then. Okay, so secondly, there is the care and support context, which is shaped by the social care workforce, the topography of the region, but also the local authority operational structure and commissioning arrangements, which did vary considerably across the region. Next are 3 interlinked processes, which are labelled as developing equity of breaks across the region, building resilient and inclusive communities, and understanding what matters in breaks provision. And these 3 processes together were described by staff as central in driving positive progress in not only how we think about short breaks, but how we commission for them as well. And within each process, there are several considerations. For example, improving coordination between local authority and third sector organisations, so short breaks are delivered in a resourceful, seamless and logical way. The efforts of all sectors to continue cultivating carer-friendly communities, so there are more organic opportunities for peer support and activities that can provide a break. And continuing to understand and embed the characteristics of meaningful provision in all variation of break models, so from the sitting service to more bespoke models such as microcare and care cooperatives, which were being piloted across the region. And lastly, at the outer circumference of the model, we have wider contingencies, and these contingencies represent the extent to which policy ambition and legislation, for example, the Social Services and Wellbeing Act and the Integrated Care Fund, exert influence on decisions locally and regionally around short breaks. One important feature being short-term funding cycles made it quite difficult to ensure effective and stable partnerships that would encourage the sustainability and scaling up of break services. So that's our working model as it stands, of course, subject to ongoing refinement. And just lastly, the next phase of the research to improve our understanding would be